So why we use point of care ultrasound nowadays than we did before? We used to have Swan, Gans catheters, central lines. All of them has invasiveness, plus it can cause a lot of complications. And this is easier way to differentiate most of the time and get the diagnosis very quickly. So it's very easily accessible technology. You can carry the small ultrasound probe in your pocket nowadays and also use the Sonosite or other companies' ultrasound machine in ICU or even on the floors running the code. So knowledge and techniques are very important because if you don't do the proper technique, you can misdiagnose many patients. The biggest advantage of POCUS is time to diagnosis is significantly reduced because you have it at the bedside. You don't have to wait for a technician, or you don't have to wait for echocardiographer to come, which may take an hour or more. Usually, we do the cardiac images, lung images, and subcostal images. For cardiac images, there are mostly the easiest images are subcostal views. And the second other, which I would suggest to do, is learn some parasternal views. And rarely you may get apical views, which would be very good if you can, but it's the hardest part of the shock stage because most patients are supine. And it's very hard to get them left lateral to get the apical images properly.